Question number 1.
Nurse Mimi is providing education to group of students. She doesn't need further teaching if she says that. In the stomach lining, the chief cells release, blank, and the parietal cells release, blank, which both play a role in peptic ulcer disease. A. Pepsinogen, hydrochloric acid. B. Pepsinogen, pepsin. C. Pepsinogen, gastric acid. D. Pepsin, hydrochloric acid. The correct answer is letter A, pepsinogen, hydrochloric acid. The stomach lining is composed of chief and parietal cells. Chief cells are responsible in releasing pepsinogen while the parietal cells release hydrochloric acid, which both plays a role in digestion and peptic ulcer disease.
Question number 2.
May Ann have developed a duodenal ulcer. As her nurse, you know that which of the following plays a major role in peptic ulcer formation? A. Spicy foods. B. Helicobacter pylori. C. NSAIDs or non-steroidal anti-inflammatory drugs. D. Both B and C. The correct answer is letter D, both B and C. The most common causes of peptic ulcers are infection with the bacterium Helicobacter pylori, H. pylori, and long-term use of nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Advil and Motrin. Spicy foods do not cause peptic ulcers. However, they can make your symptoms worse.
Question number 3.
May Ann asked you why Helicobacter pylori can live in the stomach's acidic conditions. You are correct when you said that H. pylori secretes blank, which neutralizes the acid. A. Ammonia. B. Urea. C. Bicarbonate. D. Carbon dioxide. The correct answer is letter B. H. pylori can live in the acidic conditions of the stomach because it secretes urea, which produces ammonia to neutralize the acid.
Question number 4.
The physician orders patient May Ann with a duodenal ulcer to take a urea breath test. Which lab value will the test measure to determine if H. pylori is present? A. Ammonia. B. Urea. C. Hydrochloric acid. D. Carbon dioxide. The correct answer is letter D, carbon dioxide. The procedure is done by letting the patient fast for 4 hours. After that, she would exhale into a balloon-like bag and measure carbon dioxide as baseline level. Then the patient will be asked to drink a small amount of solution containing urea. After 15 minutes, she would exhale into second bag. If carbon dioxide in the second bag is higher than first bag, then it is considered as positive for presence of H. pylori.
Question number 5.
May Ann was sent to the clinic for evaluation of epigastric pain. She describes the pain as relieved by food intake. In addition, the patient reports awaking in the middle of the night with a gnawing pain in the stomach. Based on the patient's description, this appears to be what type of peptic ulcer? A. Esophageal. B. Gastric. C. Duodenal. D. Refractory. The correct answer is letter C. The patient's signs and symptoms describe a duodenal ulcer. Here are the comparison of the types of peptic ulcers. We have esophageal, gastric and duodenal. From its location, esophageal happens in the esophagus. Gastric is for the stomach, while duodenal happens in the duodenum, which is the first part of this small intestine. One major cause of esophageal ulcer is due to gastroesophageal reflux, also known as GERD, as acid regurgitated from the stomach damages the lining of the esophagus. For gastric, it is mainly associated with Helicobacter pylori and NSAID abuse. Same goes to duodenal ulcer. Symptoms of esophageal ulcer would be trouble swallowing or painful swallowing. For gastric, pain is aggravated 30 minutes after meals or immediately after meals. In duodenal, pain is relieved by food intake, awaking in the middle of the night or 2 to 3 hours after meals. So that you wouldn't forget its symptoms, just remember, where the food goes, pain follows. When you swallow a food, it goes to your esophagus, giving you pain in swallowing, describing esophageal ulcer. Then food goes to your stomach. Pain happens immediately, which describes gastric ulcer. After 2 to 3 hours, food enters to the duodenum, which is the time pain occurs in duodenal ulcer. Refractory ulcers, also known as intractable ulcers, are ulcers that fails to heal completely after 8 to 12 weeks despite appropriate treatment with a modern anti-ulcer therapy in a compliant patient.
Question number 6.
Dr. Klein is about to order a diagnostic procedure to confirm the diagnosis of May Ann for a possible peptic ulcer disease. Which of the following test confirms this diagnosis? A. Esophagogastroduodenoscopy. B. Bronchoscopy. C. Occult blood test. D. Gastric acid stimulation. The correct answer is letter A. Esophagogastroduodenoscopy is an invasive diagnostic test which visualizes the esophagus, stomach, and duodenum to accurately diagnose an ulcer and evaluate the effectiveness of the client's treatment. Bronchoscopy is a procedure to look directly at the airways in the lungs using a thin, lighted tube, bronchoscope. Occult blood test is a test that checks for occult, meaning hidden, blood in the stool. A positive result may be a sign of colorectal cancer or other problems, such as polyps, ulcers, or hemorrhoids. Gastric acid stimulation is a test used to measure the amount of gastric acid made by the stomach. The patient receives an injection of the hormone gastrin or insulin. A tube is put through the nose or throat into the stomach and samples are taken from the stomach and sent to a laboratory for testing.
Question number 7.
May Ann with chronic peptic ulcer disease underwent a gastric resection 1 month ago and is reporting nausea, bloating, and diarrhea 30 minutes after eating. What condition is this patient most likely experiencing? A. Fascia dehiscence. B. Gastroparesis. C. Dumping syndrome. D. Somogyi effect. The correct answer is letter C. Dumping syndrome. Ideally, when food enters the stomach, it stays there for 2 to 3 hours and undergoes the process of digestion. However, due to certain conditions such as ulceration and other medical conditions, gastrectomy is performed, could be partial or complete removal of the stomach. However, when food enters the digestive tract, it moves too quickly from your stomach dumping to the duodenum. Here are the classic symptoms of dumping syndrome: nausea, bloating, diarrhea, and being lightheaded or tired. Fascial dehiscence is a significant complication of abdominal surgery. It happens when a partial or total separation of previously approximated wound edges due to a failure of proper wound healing. Gastroparesis means paralysis of the stomach, which is mainly caused by diabetes that leads to the damage of the vagus nerve. Here is the anatomy of the stomach. We have the lower esophageal sphincter, pyloric sphincter, and vagus nerve, which control the opening and closing of both sphincters. When food is introduced, the lower esophageal sphincter opens to facilitate the entry of food to the stomach, then closes to prevent regurgitation of food and acid back to the esophagus. Then the pyloric sphincter opens to facilitate food movement down to the small intestine. However, when vagus nerve is damaged, the pyloric sphincter doesn't open, so food is stagnated in the stomach and the lower esophageal sphincter doesn't properly close, causing regurgitation. The Somogyi effect happens when hypoglycemia happens overnight, leads to hyperglycemia in the morning due to a surge of hormones. It can affect people with diabetes who takes insulin.
Question number 8.
As part of nursing intervention, Nurse Mimi is correct when she provided May Ann client education on how to handle dumping syndrome, except A. The patient should eat small but frequent meals. B. After eating a meal, lie down for 30 minutes. C. Eat a diet high in protein and fiber, and low in carbs. D. Be sure to drink at least 16 ounces of milk with meals. Let's apply the process of elimination. The patient should eat small but frequent meals makes the food lighter and preventing it from immediately dumping to the small intestine, which makes option A a correct statement. After eating a meal, lying down for 30 minutes helps reduces the symptoms of dumping syndrome by slowing the emptying of food from the stomach, making option B a correct statement. The process of dismantling and reducing the proteins to amino acids takes more time, and fiber delays emptying of gastric liquids by increasing viscosity of gastric contents, delaying the process of digestion. While carbohydrates are easily broken down into simple sugar, which fastens up digestion, so should be taken in less amount, making option C a correct statement. Drinking beverages aids in lubricating food movement in the stomach, thus increasing the risk of developing dumping syndrome, which makes option D an incorrect statement. Therefore, the correct answer is letter D.
Question number 9.
May Ann is recovering from discomfort from a peptic ulcer. The doctor has ordered to advance the patient's diet to solid foods. The client's food tray arrives. Which food should the patient avoid eating? A. Orange. B. Oatmeal. C. Banana. D. White rice. The correct answer is letter A, orange. When an ulcer is actively causing signs and symptoms, the patient should avoid acidic foods like orange or citric fruits, juices, chocolate, alcohol, fried foods, and caffeine. These foods can irritate the ulcer site.
Question number 10.
Nurse Mimi is providing client education to May Ann regarding histamine receptor blocker medications. Which statement is incorrect about histamine receptor blockers? A. H2 blockers block histamine, which causes the parietal cells to decrease the secretion of hydrochloric acid. B. Ranitidine and famotidine are two types of histamine receptor blocker medications. C. Antacids and H2 blockers should not be given together. D. All the statements are correct. Let's apply the process of elimination. H2 blockers block histamine, which causes the parietal cells to decrease the secretion of hydrochloric acid. This is the correct mode of action of H2 blocker, making option A a correct statement. To easily remember medications under histamine blockers, they mostly end in INE. Ranitidine, famotidine, histamine, making option B a correct statement. Antacids and H2 blockers should not be given at the same time together. You should wait 30 minutes to 1 hour between taking the antacid and the H2 blocker, as antacids can affect how well other medication is absorbed, making option C a correct statement. Therefore, the correct answer is letter D. All statements are correct.
Question number 11.
You are providing discharge teaching to May Ann, who is taking sucralfate, carafate. Which statement by the patient demonstrates they understand how to take this medication? A. I will always take this medication on an empty stomach. B. I will take this medication at the same time I take ranitidine. C. It is best to take this medication with antacids. D. I will take this medication once a week. Sucralfate forms a coating over ulcers, protecting the area from further injury. It should always be taken on an empty stomach without food, so it can coat the site of ulceration properly without obstructions. Therefore, The correct answer is letter A.
Question number 12.
Dr. Klein prescribes a proton pump inhibitor to a patient with a gastric ulcer. Which of the following medications is considered a PPI? A. Magnesium hydroxide. B. Famotidine. C. Pantoprazole. D. Metronidazole. The correct answer is letter C. Pantoprazole. Remember, proton pump inhibitor tend to end with the letters prazole. Others examples are omeprazole, lansoprazole, and esomeprazole. Magnesium hydroxide is in a class of medications called saline laxatives. It works by causing water to be retained with the stool but is also a good antacid. Famotidine is in a class of medications called histamine 2 blockers. It works by decreasing the amount of acid made in the stomach. They mostly end in INE. Metronidazole belongs to antiprotozoal medications. It is cytotoxic to facultative anaerobic microorganisms.
Question number 13.
May Ann with a peptic ulcer suddenly vomited dark coffee ground emesis. On assessment of the abdomen, you find bloating and an epigastric mass in the abdomen. Which complication may this patient be experiencing? A. Obstruction of pylorus. B. Upper gastrointestinal bleeding. C. Perforation. D. Peritonitis. The correct answer is letter B. This patient is most likely experiencing an upper GI bleeding. Signs and symptoms of a possible GI bleeding with a peptic ulcer includes vomiting, coffee ground emesis due to blood mixture, bloating, and abdominal mass.
Question number 14.
You are about to perform physical examination to May Ann, who was diagnosed with peptic ulcer. Which of the following should you implement first when assessing the client? A. Palpate the abdominal area for tenderness. B. Auscultate the client's bowel sounds. C. Percuss the abdominal borders to identify organs. D. Assess the tender area progressing to non-tender. The correct answer is letter B. Auscultate for bowel sounds. Palpating, percussing and assessing for tenderness will disturb and manipulate the abdomen that may alter the abdominal sounds. Thus, the priority assessment should be the least invasive, which is auscultation. Question number 15. As you care for a client diagnosed with peptic ulcer disease, which assessment data indicates that client's gastric ulcer has perforated? A. Complaints of sudden, sharp, substernal pain. B. Rigid, board-like abdomen with rebound tenderness. C. Frequent, clay-colored, liquid stool. D. Complaints of vague abdominal pain in the right upper quadrant. Let's apply the process of elimination. Sudden sharp substernal pain is an indication of pericarditis or swelling and irritation of the thin, sac-like tissue surrounding the heart called pericardium, making option A incorrect. A rigid, board-like abdomen with rebound tenderness is the classic sign and symptom of peritonitis, which is a complication of a perforated gastric ulcer, making option B a correct statement. Clay-colored stools indicates lack of bile supply in the digestive tract, which means there could be liver problems or blockage in the bile ducts, making option C incorrect. Upper right abdominal pain or sharp pain below your ribcage can be caused by gallstones, a gallbladder infection, or even hepatitis, making option D incorrect. Therefore, the correct answer is letter B. Question number 16. You are assigned to care for a client diagnosed with peptic ulcer disease. Which assessment data requires further intervention? A. Bowel sounds auscultated 15 times in 1 minute. B. Belching after eating a heavy and fatty meal late at night. C. A decrease in systolic BP of 20 mm of mercury from lying to sitting. D. A decreased frequency of distress located in the epigastric region. Let's apply the process of elimination. Bowel sound consists of clicks and gurgles and may occur 5 to 30 times per minute. An occasional borborygmus, or loud prolonged gurgle may be heard is considered normal, which makes option A a positive statement. Belching after eating a heavy and fatty meal late at night is considered as normal due to the digestion process which doesn't require further intervention, making option B a positive statement. A decrease of 20 mm of mercury in blood pressure after changing position from lying to sitting is known as orthostatic hypotension. This could indicate client is bleeding, which requires further intervention by the nurse, making option C a negative statement. A decreased frequency of distress located in the epigastric region indicates an improvement in the condition, making option D a positive statement. Therefore, the correct answer is letter C. Question number 17. May Ann, who had a history of peptic ulcer disease, was admitted into the intensive care unit with frank gastric bleeding. Which priority intervention should the nurse implement? A. Maintain a strict record of intake and output. B. Insert a nasogastric tube and begin saline lavage. C. Assist the client with keeping a detailed calorie count. D. Provide a quiet environment to promote rest. The correct answer is letter B. Inserting a nasogastric tube and lavaging the stomach with saline is the most important intervention because this directly stops the bleeding. This is done by introducing 200 to 300 milliliters of water at body temperature into the tube and then lower the tube into the bucket below the level of the stomach before water disappears from the funnel, in order for the water to return. Repeat until water outflow is clear. Other interventions are not indicated on a client with bleeding complication. Question number 18. Which problems should Nurse Mimi include in the plan of care for the client diagnosed with peptic ulcer disease to observe for physiological complications? A. Inability to cope with changing family roles. B. Knowledge deficit in the causes of ulcers. C. Potential for alteration in gastric emptying. D. Alteration in bowel elimination patterns. Let's apply the process of elimination. Physiologic means having to do with bodily functions. Inability to cope with changing family roles is part of psychologic or mental alteration, making option A an incorrect statement. Knowledge deficit is also part of psychologic alteration, making option B an incorrect statement. Potential for alteration in gastric emptying is a physiological complication and happens with peptic ulcer caused by scarring of gastric linings, which we can consider option C as a correct statement. Alteration in bowel elimination patterns is a physiologic complication. However, this mostly happens with lower GI problems such as colorectal cancer and diverticulosis, which makes this statement incorrect. Therefore, the correct answer is letter C. Question number 19. May Ann, who was diagnosed with peptic ulcer, is about to be discharged. Which expected outcome indicates that the goal of client's condition was met? A. The client's pain is controlled with the use of NSAIDs. B. The client maintains lifestyle modifications. C. The client has no signs and symptoms of hemoptysis. D. The client takes antacids with each meal. Let's apply the process of elimination. NSAIDs or nonsteroidal anti-inflammatory drugs are one of the main causes of peptic ulcers. Therefore, this option is incorrect. Maintaining lifestyle modification is a good sign that the client have coped up from the stress caused by the disease, which makes this statement a positive indication. Hemoptysis is emission of blood from coughing related to pulmonary diseases which doesn't have any connection to the issue, making this statement incorrect. Taking antacids with each meal indicates that the disease is not yet cured, making this statement incorrect. Therefore, the correct answer is letter B. How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.